What I'll do is, I'll show you certain scenarios, then allow you time. You have a conversation with your group members, decide on some conclusions, write them down, give it to the representative who gives it to me. Simple. Everybody understands that? So I'll show you, I'll give you a certain number of questions. You process those questions as a group. This is the difference. You need to learn how to work in a group. I know the seating arrangement is not very ideal, but try your best. Okay. Once you conclude, the representative needs to have a piece of paper with my answers on it. Capish? Okay, let's start. Right, group activity. So now is the activity group 1, 2, 3, 4 be active now. There are two activities. One is we will go through certain scenarios which will check your knowledge of these concepts. So we'll be looking at some clinical stuff, but the baseline physiology is of compliance and elastance. And the second group of conditions which we'll see, the base concept is work of breathing. Okay, you will understand as we go along. Okay, but you now cease to be as individuals. You are now one with the group, right? If you fail, the group fails. That's how it is. Just a revision for those who are not with the program. These are the terms, these are the definitions. We've covered them already. This is the same slide, basically. What is it? Compliance is a measure of distensibility. We know this. Elastance is a measure of recoil. Okay. Work of breathing. I dedicated a very significant chunk of the last lecture to work of breathing. I don't want to go into that. I hope you've studied it. We will see. So work of breathing is a measure of air resistance. And normally the lung is a well-oiled machine which only expends less than 3% of the total energy, i.e., the compliance, elastance, and work of breathing are put together in such a way that not a huge amount of effort is expended or required to expand this lung, and the expiration basically happens passive. This is a normal lung. It's nicely distendable, good compliance, recoil is kept in check, work of breathing kept in check. With this information, let's dive in. You will get about 10 minutes per activity. So please watch the time. Work as a group, take papers out, pencils out, and turn on your brains. Right. So you need to work out on these 6 things. How? पहले सुन लो ताकि समझ आए करना क्या है. So one is, this is compliance versus elastance. So you have to comment on compliance and elastance in this thing called pulmonary fibrosis, which I have been talking about off and on. Pulmonary hypertension, I haven't mentioned. Work it out. Decrease surfactant, we have just done it. These three. Normal aging. Normal age, as you progress through age, the lung becomes whatever. Comment on compliance versus elastance. Asthma, and finally M5C. You have 10 minutes. So I need these 6 answered for compliance and elastance. You're supposed to work it out, not Google it out. Use of technology is not allowed. Not in this scenario. So first observation, listen up. First observation, it's a different experience, isn't it? Working on something. However difficult the seating arrangement may be, but you did try, and I appreciate it. That's the only positive comment, really. The second, the second point observation is, uh, I forgot to mention, don't cheat. It's really my fault. I should have clarified, don't cheat. Okay, this is a preparatory thing. Okay, inshallah, in your exams, you will not have the facility to call a relative, like in those game shows, or look at your phone, or help a colleague. No, we usually don't allow that. You're on your own on that. Number three, the group representatives. Obviously, this is the first time and it's a huge responsibility. uh, I had envisaged that there will be a nice, neat single paper where they agreed upon consensus on the six things. What I am seeing is an atrocity of papers, lots of papers flying around. So I don't know how this will work out. But since it's a competition, it has to be interesting. Okay. So now group one and two will swap these responses amongst each other. ग्रुप वन का रिप्रेजेंटेटिव ग्रुप टू को दे दें और ग्रुप टू अपना जो हिसाब किताब है वो इनको दे एंड ग्रुप थ्री एंड फोर विल डू द सेम okay now you guys go back to your respective groups go back I'll put on the key okay so you can see what the other groups did now remember you have to critically mark not too critically remember you have to critically mark this thing that is in your hand marking aapke haath mein right okay this is the key. I will slowly go through it. Okay. Now, listen up. Listen up. Don't worry about the marking. That can come in later. पहले समझ लो कि हुआ क्या. So, this is pulmonary fibrosis. We know that it is a restrictive lung disease. It's a type, the restrictive type of lung disease. We have been talking about this. The compliance decreases in this group of disorders, and the elastance, i.e., the elastic recoil, increases. That is what defines a restrictive disorder. The elastic recoil is too much as compared to normal lung, and hence it is a what lung? Stiff lung. It's a stiff lung. So this example here is of a stiff lung. Okay, so whoever wrote or whoever thought in the following terms, they are correct. Number two, pulmonary hypertension. Obviously, the word hypertension would give you something. It's not normal. There's too much blood pressure, too much pressure of blood inside the lungs. Now, too much blood, not normal, too much blood can cause congestion. What is congestion? The blood will start to pool inside the lung, which will affect its distending ability. This lung will again have decreased compliance and will tend to not be open, which is elastance. Although directly it doesn't have increased elastance, it has decreased compliance due to that congestion, that fluid which is sitting in there, which is not letting it expand properly. Surfactant should be very, very easy because decreasing surfactant would increase the surface tension forces, which will decrease compliance, okay, and increase elastance. So this is the key for all these three topics, okay. Now, what about aging? With aging, remember all of these conditions, all of these three things, this is the key. Compliance increases, elastance decreases. So with age, as the old sock example, with age, the elastic fibers they lax, right? They are not as taut as they are in a young lung. So normally, as the age of the lung progresses, it becomes baggy, okay, and it's easy to distend it. However, it's difficult to contract it. Relatively speaking, it's not COPD level, but still, this is the phenomena because of those laxed fibers. Remember the old sock versus new sock example. Asthma, for some unknown reason, compliance increases and elastance decreases. Emphysema is again we end with emphysema, is an obstructive disorder as opposed to restrictive disorder. The good students will immediately try to remember that this was under this group of conditions, the ones which had less compliance, more elastance, and this I think we have described it a lot. It is under the condition of increased compliance. Which part of compliance? Which type of compliance? Static compliance. So static compliance in emphysema increases. Okay. However, dynamic compliance increases. Okay. And elastance decreases. Okay. Why does elastance decrease in emphysema? Okay. Now listen up. This is pretty cool. Not what happened to the gentleman. He has severe emphysema, and this is his corpse. You can observe the chest in a lying down individual. This is that typical barrel shaped chest of a serious chronic emphysematis patient. Okay, he died of emphysema of air hunger, and the barrel shaped chest is in emphysema is there because this should you should know now. Why would there be a barrel shaped chest in emphysema? Eventually, a chronic emphysema patient will experience expanded chest. We also call it pigeon shaped chest, like pigeons. Why? Heart, bete, heart, heart. Why? You. Air hunger, which is, yes, and oxygen hunger. But what? How does it make the chest barrel shaped? During during हाँ इंस्पिरेशन में जो एयर आती है उसको आप एक्सपायरेशन में you can't breathe it out. Thank you. Hence that chronic trapping of air, even though accessory muscles of expiration are really being used by this blue bloater or pink puffer, by this pink puffer, still chronic emphysema of the severest type usually results in air trapping, literally restructuring of the alveolar tree in such that the alveoli, which look like nice grapes in a healthy lung, with each grape distinct, they coalesce. They combine to become big little balls. Okay, so there is a architectural bad stuff happens to architecture. Okay, and the whole thing just changes as this disease goes along. There's literally breaking of the fibers, the architecture of the lung. On that point, have you heard of the smoker mice? Of course you have. So in experiments, they exposed smoke on a group of mice. Guess what happened to their lungs? They developed emphysema because of cigarette smoke. Because what does cigarette do? The smoke. What the smoke do is when you inhale it, it goes right into the lungs, deeper structures, alveoli, and all that. In chronic smoking, when you this is an the smoke acts like an injurious agent. So it injures literally, it injures the lining of the inner lung. The more you smoke, the more injury it gets done. So what happens when there is a foreign agent which enters the body? How does the body react? By coughing, yes. By increasing the macrophages? Yes, inflammation. Shabash. You've just done blood physiology. So inflammation is that whole cascade that gets triggered by the body whenever there is an invader. Smoke in this condition is the invader, by the way. So the lining of your lungs, they start to recruit more leukocytes, more macrophages invade or are given a 911 call. Okay, quickly come. There is an invader. So smokers have a chronic inflammatory situation in the lung. Is this okay? अभी तक ठीक है? The bad part is a chronic inflammation is never a good thing. Inflammation should be short, sharp, and back to normalcy. You get a sore throat, stuff gets inflamed, Leukocytes come, kill the baddies, and infection is resolved. If it's not resolved by the body, you take some medicines and they do the part of the inflammatory markers, and it's done. So this is the nice part of inflammation. However, remember please, many of the famous diseases have a component of chronic inflammation to them. I don't know if you will remember it, but it will come and hopefully you will connect it. Most of the famous diseases, i.e., the known diseases, have a chronic inflammatory component to them. That is the bad thing of inflammation. So these invading macrophages, they bring along the artillery, the weapons that they have. Normally, the elastin fibers in the lungs are intact. But in the smoker, something happens because of that smoke that he is inhaling or she is inhaling. What the smoke does is it triggers an enzyme called the elastase. Elastase. So elastase enzyme normally is present in the lung, but it's inhibited. It's not very active. Smoke through the chronic inflammation, bringing in the macrophages and all that thing now changes the whole scenario, and elastase enzyme becomes hyper. When it becomes hyper, it starts to literally chop off the elastin fibers, introducing emphysema. The breakdown of stuff which happens in emphysema, this restructuring that I have been talking about since probably the first lecture. Today, we are introducing the molecular events of it. So it's the elastase enzyme which goes out of hand, which then starts to break because it's elastase. It will break elastin fibers. There is also mention of trypsin enzyme. So all of these enzymes are protease group of enzymes. You will read them in biochemistry. So there is protease and anti-protease balance in the normal lung, which is tripped in favor of the proteases by this stuff, smoking, because of that inflammation and all that stuff I just hinted towards. It's a big topic, but I want to just give you enough so that when you actually start reading eventually in medicine, you will understand, this is the protease, anti-protease, trypsin, anti-trypsin balance of COPD. Okay. So coming back to the mice, what they did was they got, how did this theory come about? How did they discover it? They had two groups of mice. One group was exposed to normal, they were exposed to cigarette smoke. They developed, in a certain period of time, they developed emphysema, COPD. The other group, what they did was very clever. Do you know knockout model? Knockout model. So there are animals in which we have now the technology to switch off certain genes. So we literally knock off a gene or two genes or whatever. Now you know that every protein is made by a transcription process of a particular gene. So what if in this group of mice, I were to switch off the elastase enzyme? Enzyme is a protein, right? So the gene responsible for making this enzyme, I knocked it off. I disabled. This group of mice will not be able to make the elastase enzyme at all. Yes? So when they are exposed to the cigarette smoke, will they develop emphysema or not? They won't. And they didn't. Which is a very strong evidence that smoking causes emphysema through this business, this elastase business. Okay? Knockout or K/O. This you will read, especially the ones who are interested in research. You will read this a lot in genetic studies. Knockout model of animals has given us so much insight into so many diseases, and it's not stopped. It's increasing and opening new doors. Okay, sorry. Activity two, shorter, 5 minute, same scenario on work of. Sorry, see, we'll not do the group activity thing. We will do it as a class and me. Kapish, less time, more time for having those dirty samosas. Okay? These are the four things. The quicker you answer, the earlier you will leave. Okay? Mice, experimenter, let's start the experiment. Four scenarios, you have 20 seconds, work it out. Okay, fine. Let's solve it now quickly. The samosas are waiting. Pulmonary fibrosis. What about work of breathing? Will it keep be normal? Will it increase or decrease? Up, पढ़ लो और भाग जाओ. You read it. If you don't have a question, you can leave.